Staying on the African continent in a bid to foster a healthy population, African leaders have come together to reiterate the need to actively direct resources and efforts to curb the spread of polio on the continent after their previous successes was hampered by the COVID-19 outbreak. The African continent has made significant progress in its decades-long fight against polio, a life-threatening and vaccine-preventable disease caused by the poliovirus. Over the past decade, the African health community has worked towards increasing the number of children receiving vaccines, resulting in increased immunization rates across the continent. But this is still being hampered by COVID-19. Joining me in the studio to talk more on this is Chief of Health, UNICEF Nigeria, Eduardo Celades. Good to have you join us.
Thank you very much. Good afternoon, please.
Good afternoon. I know that you have been moving around Lagos, especially to try and get people vaccinated for COVID and then children for the routine immunization. Talk to us about the response you're getting.
Okay, I just came back now from Alimosho, LGA, where I really saw like an amazing response. Like more than 60 people were there with their children to get normal vaccines, routine immunization vaccines. But as well, we looked into the data and we saw that even today, almost 10 people were vaccinated in one particular public health facility. So really, if you look to the success of COVID-19 vaccination, is incredible. What happened in the country for the last year, more than 90 million doses of COVID-19 doses administered, more than 71 million Nigerians vaccinated against COVID. If you ask someone if that was going to be possible 1 year ago, everybody is going to say no. But Nigeria, once again, said it's actually possible.
But today, in particular, what was the response to the COVID-19 vaccination?
There were not too many people. We expect that. We expect that. It was a fixed post, so it was not like a mobile post that goes even house to house. Okay. So this is a fixed post. So there were not too many people today. But this is within what we can expect because the vaccination rate now is 70% of the eligible population. So it's quite high for COVID-19.
Absolutely. And let's also believe that people are at work at the moment. But let's talk about the challenges you're facing in terms of immunization and what more can be done.
So from the UNICEF perspective, we see two main challenges to increase routine immunization. The first one is that the health systems are very weak. Like primary healthcare systems are weak. They don't have enough nurses, enough doctors, enough resources, enough commodities to provide the services that the population need and the vaccines. The second challenge is inequalities. Inequalities among the north and the south, among the rich and the poor, among the urban and the rural. So we as UNICEF, what we want to do is to strengthen the health system, putting the resources that they are needed, but as well to reduce inequalities. And the main indicator for that is what we call zero-dose children. That is the number of children, or the children that they don't have any single vaccine. And more than 2 million children in Nigeria every year, they miss all the vaccines.
Is there a particular reason for that, and how is that being addressed?
So this is what we are working on. It's a mix of reasons. One big reason is, for example, inaccessibility. It's a lack of access. That, for example, in the Northwest or the Northeast, due to insecurity or violence. But as well, there are other factors, like, for example, that we don't have community health workers. We don't have enough nurses, enough CHUs. So we are really trying to do a granular analysis where these children are. We know that, for example, only in 2 LGAs of Lagos, there are like more than 200,000 children with any single vaccine. And trying to address that with mobile brigades, with more health workers, etc.
And I know that you've also sort of linked these 0 doses to diphtheria and other diseases, because people who are not immunized seem to be sort of more susceptible to some of these infections we're seeing going on around the country and even part of Africa.
Correct. This is what we call vaccine-preventable diseases. Just think in measles, in meningitis, in diphtheria. All of them are easily prevented with a single shot, right? What we are seeing now in Kano and Lagos, for example, is a big outbreak of diphtheria. And we did an epidemiological analysis to see which children were getting sick. So there were children that they didn't get vaccines, but now there are children that they are between 5 to 11 years old. So what it means, like 5 years ago, they didn't get the vaccines that they needed. So to me, the point and appeal to the population is like, vaccine your children. The disease is going to catch you. Sooner or later, it will be there. So if we do the right things, if we care about our children, about our families, do the vaccination.
And we can prevent some of these casualty figures we're seeing coming out from this these diseases and infections were seen. Thank you so much for talking to us. We hope that you get the response, the appropriate response from parents, bringing out their children, because vaccination is very important. Thank you so much for talking to us. Chief of Health, UNICEF Nigeria, Eduardo Celades.
Thank you.